if you have any questions. And so the purpose for today is to discuss the Healthy Chicago Survey RFP. Will to provide some transparency on what the purpose and the expected deliverables and the evaluation plan is. Let me share my screen. Okay. And, my computer's just working a little slow. Okay. Can everybody see my screen now?
Yep.
Yes.
Yep. Thank you.
Wonderful. Thank you. Okay. So I want to thank everybody for joining us today. We'll cover what's involved in the request for proposal and also provide an opportunity to and the deadline for asking questions. We will provide responses to questions within 2 days as well, or by the 22nd. Wednesday, the 22nd is our date for that. So the RFP is created for City of Chicago's Community Health Improvement Plan. The Healthy Chicago 2025 is our health equity plan, and that's creating a vision of creating a city with strong communities, collaborative stakeholders where all residents enjoy equitable access to resources, opportunities, and environments that maximize their health and well-being. We are committed at CDPH to promote and improving health of Chicago, engaging residents and communities as well as partners, and really prioritizing communities with the greatest need. We started Healthy Chicago Survey in 2014 in order to collect reliable and timely data on root causes of health and health inequities for adults in Chicago, and to be able to use this data to act on improving health equity in our health equity strategy and improving public health practice. The RFP we're issuing is part of this our continued efforts to enhance methodology, participant outreach, design, administration, and dissemination. We collect a representative sample of Chicago adults by race, ethnicity, age, gender, sexual identity, ability, disability status, educational attainment, employment status, income, and other key demographics. Historically underrepresented groups in our Healthy Chicago survey unweighted samples includes Latinx and Asian American residents, younger adults under 30, and people with lower educational attainment. We revise our questionnaire yearly to collect actionable data that helps us respond to current and emerging public health priorities. And we go through a root cause approach to improve health and health inequities, looking at the structural and social determinants of health. So it's really critical for us to be able to get not only Chicago estimates for all the major demographic groups, but also estimates for our 77 community areas. So also to be able to align with our strategy, we want to be able to monitor trends. So we have historical trends of key health indicators that we have been tracking, and we try to keep a very minimal impact in changing our ability to evaluate these trends. Um, and then we also are looking for a budget that appropriate reflects and weights these priorities. We seek sustainable funding models so we can minimize this administrative burden and the cost associated. The available funding for year one is $550,000. This is an award period for 3 years with up to 2 single-year extensions. And the extensions are at the discretion of the city based on the availability of funds, the need to extend the services, and performance. We look at implementation and management plan as part of this RFP process. And we ask respondents to provide a comprehensive implementation and management plan for um, continuing or any updating any methodology and administration. Currently, Healthy Chicago Survey uses address-based sampling and a sequential mixed mode data collection. We do what we can to maximize representation in Latinx and Asian residents, in adults that are under 30, and those in adults with lower educational attainment. We also are always evaluate on producing prevalence estimates for the 77 community areas. Currently, 2-year pooled data set allows us to produce these prevalence estimates. And then also we have a need to be able to link the Healthy Chicago Survey respondent data with referenced environmental point data so we can understand the health impacts to these and based on the proximity to these community assets. The implementation and management plan should demonstrate capacity to successfully implement and manage the Healthy Chicago Survey, ability to comply with the scope of services and requirements, and that includes in terms of service delivery, management training, and support capabilities, commitment to health and racial equity. Some expected annual deliverables would be administering this award through a multi-year contract. Each year, defined task order with scope of work, including the budget and timeline based on the specific parameters. Some of these parameters will include number of completed surveys, the questionnaire length, languages the survey is translated to, and participant incentives. So each contract year, the contractor will be required to provide the following deliverables, and that includes the draft and final survey questionnaire in English, and then any other languages that are defined in the task order. Currently, we have the survey available in English and Spanish. Previous years, we have used other languages as we have translated into other languages as well. Detailed mixed mode address-based sampling plan that includes information on sample size, processes and procedures, epi and statistical methodologies that are employed to ensure adequate representation and reliable prevalence estimates for the target population, including any agreed upon and any of the demographic groups that we agree upon, having representation representativeness with. And then the sampling plan might also include oversampling these select demographic groups or geographic areas that have been historically underrepresented. Um, IRB applications or any amendments for reviews, if or for CDPH or any of the contractors required IRBs and any other applicable IRBs. Um, then sample of residential addresses as well. We don't prefer landline random digit dial, but if you are proposing random digit dial, landline telephone numbers and cell numbers, if that's applicable. Report on number of qualified survey staff and subcontractors hired, including bilingual staff. The training plan schedule and all training materials used for interview or training sessions. Report detailed pre-test and pilot results in English and any other languages the questionnaire is translated to. Weekly data collection reports and bi-monthly sample data sets for quality control purposes, beginning once the data collection starts and continuing throughout the data collection period. The final SAS data set with the documentation, including weights and guidance for applying the weights. We use a secure file transfer portal site to share data or to receive the data. Written methodology report, including the survey procedures, analysis of sample performance, weighting the procedures and other study details, and then post-survey consultation. If there is a shift in the data collection, study design, or methodology that we are currently using for the first year, only a report that summarizes the impact of this shift. Oop. Okay, evaluation of proposals. So we score in full points. For each score, the evaluators will provide a brief note on why the score was given. Each of the proposals will be reviewed by a minimum of 3 of our evaluators. And then our reviewers will all receive their assignments by Friday, December 8th. The RFP deadline is Thursday, December 7th. Reviewers will essentially immediately receive those proposals, and then we have a consensus meeting held that we're holding on December 19th that will require all reviewers to be present. Quick note, if they're at the consensus meeting, the evaluators decide a presentation is necessary, the next step would be requesting a presentation, and all reviewers will be present at this presentation. The evaluation criteria has several categories. The largest chunk of the points go towards community reach, but this includes a lot of different components, and that includes factors related to sampling and data collection, multilingual capabilities, and the commitment to health and racial equity as seen in the sampling plans and methodologies. Staffing plan, the schedule of compensation, technical expertise and capacity, management and support capacity. All of the evaluators have a scoring rubric for all the components. So this is an example of what that looks like. Each factor within the section will have a point maximum. So for example, the sampling method has a 9-point max, and there's a scoring rubric based on the criteria for the evaluators to follow. These will be full points only. Any questions with this, you can please reach out to me, Hannah Matsky, with any questions. And we have any questions that come from today or via email. The last day to submit a question is going to be 5 p.m. Monday, November 20th. And we will have our responses for these questions by 5 p.m. Wednesday, the 22nd. I want to thank you all for coming today and open up the floor. See if, Nick, did you want to add anything?
No, I think that was thorough and comprehensive, and just look forward to being able to answer any questions people might have.
Okay. I'm raising my own hand. If anybody has questions, please feel free to jump off mute or raise your hand.
Hi, I did have one question about the anticipated contract type for the opportunity. So it looked like, based on the various different budget schedules, that it was a fixed price contract or fixed price with variable fixed unit prices. But would you be able to clarify the anticipated contract type?
I can find the answer for you. I don't want to misspeak. But I can speak to our contracts and finance to double check what this will officially fall under.
Okay, thank you. And then I guess I had a separate question and maybe it would just be a follow-up depending on if it truly is a fixed price contract. There were several other requirements within the RFP that seemed like they were more geared to a time and materials or a cost reimbursable contract, such as providing like salary data and some other fringe benefits. So I guess the follow-up to that would be, if it is fixed price, are some of those other requirements necessary if companies typically don't disclose that type of sensitive proprietary information?
Yeah, I think the same answer. We can take that back to the contracts team and provide the answer to in our response document.
Yeah.
Great, thank you.
I just also wanted to confirm about the total cost of the contract, because it did say 550,000 per year in one place and 1.1 million in another. So I just wanted to confirm what the actual overall 3-year ceiling was, please.
It's 5.5 per year. So it's 16. It's like 1,650,000 for the 3-year.
Okay, thank you. I appreciate that.
I would like to follow up on that question. We were going to ask this similar question in writing, but 1.6 over 3 years, how many waves data collection is that? Because there's a couple different places where it's inconsistent?
It would be 3 years of data collection.
Okay.
Can you
Thank
just
you.
cite the inconsistency so we can note that?
Yep.
I had a question on the MWE MBE requirement. Can you confirm if one company can fulfill both requirements, or does it have to be two separate?
One company can fulfill both requirements.
Okay, thank you.
Just to clarify that, it has to be registered as an MBEWB, both the MBEWBE, Nick, right?
That's correct. Okay, well, it seems like people will prefer to submit written questions. That's great. Are there additional documents that would or can be reviewed, Hannah, by the group? Or do they have everything they need?
I think everybody has the information they should need in the e-procurement site. I assume everybody got the solicitation notice from the website. I'm putting it in the chat right now. But all the questions on that or all the information on requirements are going to be in the solicitation notice. The questions again are going to be due on Monday, November 20th by 5 p.m. And we will send responses by Wednesday, the 22nd. Nick, can you help me with one thing? Questions that came in today, how do we get the responses back to everybody? Should we collect information?
You mean the questions that were verbally asked today?
Mm-hmm. Yeah.
We'll just transcribe those into the document.
Okay. Okay. So that'll be posted in the RFP site?
Correct.
Okay. Perfect. So those will be posted by Wednesday, the 22nd, 5 p.m.
And then a copy of the slide set can be also posted in that same location? Or would people want to review those slides before that date?
We can, yeah, I can ask, who, I think it's Candace that I would ask to post it up there.
Yeah, that's good.
I can do that. Yeah. If anybody has questions, feel free to stay on. I'm gonna stay on the line for a little while, I think, until I have myself scheduled here till 3 p.m. So I'll still be online for an hour, but if you don't have questions or prefer to submit via email, you don't have to stay. Oh, Naomi.
Sorry, I just wanted to ask a clarifying question about the MBE, WBE. There's so much in the RFP about meeting those goals, but I just wanted to clarify because I'm looking at page 65 and it says firms that are certified as both MBE and WBE may only be listed on a bidder's compliance plan as either an MBE or WBE. But if they're registered as both, they can count as both. Is that what you were saying?
That's my understanding. That is I understand your confusion with the interpretation. We will clarify and post a response.
Okay, thank you.
Sure.
Can I ask about the languages that are listed in the RFQ? So, there is a very different set of languages this year as opposed to previous years, and it's not really clear if all of them are required, or, for example, with the different modes, if you would expect a hard copy instrument to cover all languages, or if that's at our discretion. I was wondering if there's any more detail about that.
Languages we would require would be in all modes would be English and Spanish. Languages that would be proposed kind of at your discretion and would be the other most common languages spoken in Chicago. And those wouldn't have to be included in all the modes.
Okay, thank you.
There's one section that talks about combining samples for areas over 2-year period, right? Because I guess it's not large enough for 1 year. And this contract is for 3 years. Are you anticipating also combining it for 3 years, or is it going to be the first 2 years that we're going to be combining, for the last 2?
It would be the first 2 and the last 2. So it would kind of be rolling, yeah.
But you will not want to have like a 3-year combined and a separate weight for that.
That would not be necessary or required unless there was some compelling reason or rationale to do something with that 3-year estimate.
Okay, thank you. And just to confirm, the sample size is between 4,000 and 4,500 per wave. So 3 waves of that size.
I'm sorry, could you say that again?
So the sample size per wave is between 4,000 and 4,500
Oh, yes, per each year. Mhm.
per each year. Yes, thank you.
Just checking in to see if anybody has any additional questions or if people are formulating them.
Thank you.
Thank you.
Thanks, Anna. Great job.
No, thank you, Nick.
Yeah.
I was just gonna kind of keep an ear out in case anybody jumped in for questions.
Yeah, I guess we did open it till 3, is that right?
Yeah, I did
2:30?
keep it open till 3, but
Just
yeah,
you can just keep it on in the background.
yeah.
I'll be around if you need anything, but
Okay.
I think these are typically this is my first conference, like not in person, so it's almost the